Welcome to day 2 of our training on mesenchymal stem cell therapy. This is the second day of me getting my IV infusion of mesenchymal stem cells with over 120 million stem cells per day. Today we're going to be discussing the differences between stem cells and exosomes and NK cells and what we're looking for when we make an investment in stem cells, what makes them good. We're also going to be going over my experience because I am actually getting the stem cells right before I'm doing the training with Dr. Eduardo, MD, the main doctor here at the clinic, Rehealth. And we're going to be discussing what my results were, what my blood work looked like, and what we want our blood work to look like if we do get stem cells, and who should get them, who shouldn't, and what we're looking for when we get good stem cells, like the viability, the amount we need for clinical results, and the importance of a HLA-DR negative gene. So a lot to go over today. If you want to have a free consultation with this clinic to discuss you and your family's choice to use stem cells, you can click the link below and set up a free consultation to discuss your case, your needs, and how this can help you. Now, if you're getting value out of this video today, please like, please subscribe, please comment. It greatly helps us in the channel. Thank you for that. And without further ado, let's jump into today's training with Dr. Eduardo. Happy healing.
So day 2, we are now going to get our second infusion of 100 million stem cells at least. And first day was very exciting, and I'm excited to see how this does. Hopefully I can sleep a little bit better after the second infusion, but I'm getting it early in the morning, and I'll have the rest of the day to relax before getting back on a plane to Orange County, California. And it's been very pleasant just to be at this beautiful hotel. Just a wonderful place to come do a therapy and enjoy the beach, the views, the water. They've got a great steam room and sauna. So I stayed here at the Westin and just absolutely enjoyed it, and a little bit more cost effective than some of the other fancy hotels around here. So that's been nice, and would recommend this place. So let's get started on day 2.
Hey guys, welcome to day 2 of the 100 million plus mesenchymal stem cell therapy. It'll be here for about another hour. It takes about 60 to 90 minutes to get the total infusion, plus your immunomodulator before each session to reduce, just for safety's insurance, to make sure your body takes it well. There's no cytokine storm, but we know there won't be a cytokine storm because these specific mesenchymal stem cells are from the umbilical cord lining, as opposed to the umbilical cord blood or the Wharton's jelly. Those are two different places people can get these stem cells from, but these are the safest, but more expensive to get. So there's almost an impossible chance I have a negative reaction. That's one of the reasons why in the last 12 years, this clinic has never had any extreme negative reactions where someone had to be hospitalized. Most reactions might be a heating of the body, a lot of energy at night, which I definitely experienced last night. And maybe a little fatigue while you're getting them, but that's about all the symptoms we can expect. It takes about 60 to 90 minutes per infusion, so I'll be here for about another 45 minutes with my feet up, just relaxing. And so far it's only been 24 hours, but I'm feeling good. One thing I also noticed is I had a little bit of tennis elbow, and today, just as I move my arm, maybe it's a little bit of in my head, but I do feel that my muscles and my tennis elbow feels fantastic at the moment. And you can get a local injection if you do have a tear or any kind of damage to a tendon or any arthritis. But I didn't get that, still feeling as though my elbow specifically feels very good, and I feel very strong. So last night at 1 in the morning, I felt like I could have gone for a workout, but my heart rate still was around 67, as I said. So feeling good, very excited about the promise of this therapy, and I'll know more in a couple of days.
Welcome to day 2 of my mesenchymal stem cell therapy here with Dr. Eduardo. Thank you so much for being here today again.
Always a pleasure.
So day 2, we want to talk about stem cells, where they're derived from, where we can find the best results for autoimmune disease or IBD based on where we're getting those stem cells from. We're going to talk a little bit more about the differences between stem cells, exosomes, NK cells.
Right.
We're going to talk about what I'm going to be doing as I leave, because I'll be flying out tonight, which is also very courageous, right? You can get this therapy, you can go about your day, you can fly out. So I'll be leaving back to California. I've got a 5-hour flight back, and I feel completely fine to do it. And what am I going to be expecting over the next week or two? What's going on with my blood work now? What do we know? And what should I stay away from to make sure these stem cells get the best result over these next few weeks? So that's what we'll be discussing today. But first, I want to give you an update on last night. Last night was my first night after the 100 million plus stem cell therapy, and then this morning, and how am I going today? So just like Dr. E here said, I was tired after I got it. That's from the immunomodulator, right?
Correct.
So which helps make sure the system's very calm to accept the stem cells. So I felt tired. I just got another 100 million about 10 minutes ago. I feel a little drowsy right now, as you said. And then he also said to me, he goes, look, you're probably going to get a lot of energy in the night. He goes, it does happen to 50-60% of our clients. I tend to be sensitive to through therapies. I couldn't sleep last night. I was up. I felt strong, invigorated. And first I was thinking, is my heart racing? You know, is there something going on here? But no, I checked my heart rate. It was pretty normal, a little higher. You know, it was in the 60s, 70s. I usually sleep in the high 40s, 50s, and it was normal. But I felt this rush of strength. I felt like I could have gone and lifted weights. I had a hard time turning off my brain. I thought about all the great things I was going to do and what I want to do in my life, and I just couldn't fall asleep. So it wasn't a bad thing because I felt like, wow, I can already feel an effect of the stem cells. I already felt good, and I felt one other thing is I tend to get a little pain in my elbow from tennis elbow, and it just every muscle as I contract my muscles do feel like there's no inflammation. I feel calmer in a way. I mean, a lot of you are very sensitive and really feel in tune with your body. You'll understand what I'm saying when you do this, that my body feels calmer but stronger. And I just felt this, I did feel a sense of youthfulness, like strength, like, you know, you get those little back pains when you wake up, or tightness. I just felt a little stronger in the morning, and you don't know if that's in your head, but, you know, I just got this amazing therapy, so... but I do sense, and I feel I know my body very well, that I do feel a sensation of feeling better. And I don't have any symptoms of Crohn's colitis, but I can tell a difference already. And if that's placebo, that's fine, I'll take that too. But and then, you know, so lots of energy, had a hard time sleeping, having a hard time turning off my mind. My eyes are tired though, because I didn't, you know, I'm a 3-hour time zone difference, so trying to go to bed at 10 o'clock Eastern is tough for me because that's 7 o'clock California, so that plays into it a little bit too. But my appetite's been great. I had a huge, wonderful meal yesterday. I had a steak with salad and water. I stayed away from any alcohol. I stayed away from anything that could cause an inflammatory response, which we discussed yesterday. So a little tired at the moment, but I'm expecting that my energy is going to go a little bit higher. And you, Dr. E, said, hey, you might not be getting that same energy on the second dose. The first dose is usually when it happens, but we'll see, and I'll let you guys know. So you've been spot on so far.
Right.
And no other effects, no other problems. Gut feels great, feels calm, sound. I don't feel any inflammation or problems in my body. And
this is the usual. We're not expecting any. All
Yeah.
of our patients feel just like you.
Well, yesterday I did get a little bit of body temperature increase. So when we were doing yesterday's training, I did feel a sensation of, it wasn't a flu, like you said, it wasn't a flu, but it just, my body was hotter.
Right, and you can notice that whenever you're tracking it with this type of gadgets. But
yeah, like a Whoop or a Garmin.
But most people will not realize. It's just like you're saying, you're aware about your body. You're used to listen to your body,
Yes.
right? But a lot of patients will not. So they will not realize, most of them, they will not realize this slight increasement on body temperature, because at the end, it won't be like having a fever reaction. It's not even fever. It's not even a feverish reaction. It's just a tiny increase on body temperature.
And that's exactly what it was. I didn't feel fluish. I didn't get a headache. I didn't have a fever. Just my whole body temperature elevated slightly, and I could tell during the training as we talked about.
Just like the heart rate that could get increased just a bit as well, but that's just because your body is working a bit more. You just received millions of cells directly into your stream, so that's it.
Yeah.
It's just the body making friends with them. That's it.
So I'm very excited. Let's see what is in store over the next few days, the next few weeks after this therapy.
So, I'll be flying back, but, flying 5-6 hours, time zone differences, those stressors shouldn't be a problem for the stem cells, right?
Not at all, not a problem.
Okay.
Yeah.
So maybe good things to do is try to sleep on the way back, drink lots of fluids, stay away from processed foods and sugars at the airport, stay away from alcohol, don't drink on the plane, try to get some sleep, and that should probably help them be most effective.
Right, just do what you know is good for you. That's it. That's easy.
Okay, wonderful. So we have some breakdowns of what's next steps are and some blood work back that we'll go over.
Right.
And the biggest thing with blood work is we wanted to see that the leukocytes were normal before doing.
Correct.
Right? So showing no active infection of
Correct.
some sort like the Colitis flu. That was normal. We ran some other blood work just to also see some other numbers.
Well, as this is the first time we were having you as a patient, we wanted to have the most complete idea of your actual stage of health. That's why I ordered a complete panel, a comprehensive panel, which is now shared with you, and just like the way it's shared with all of our patients. We always give them this report or this exit letter and folder, including the most important part for me, which is the stem cell therapy report, stating the exact amount of cells that you receive in between each of your drips.
Okay.
Or if you were having the articular injections or the intrathecal application of the cells, it will be described in here as well.
Wonderful. So how many stem cells did I receive?
Well, in your case, you had 242 million.
Whoa, okay. So that's a large,
Yeah.
that's 10% more than what was communicated to me when I invested in this. So that's quite amazing.
Right. Actually, 20% more, because the average dosage should be about 200 million, and you get 242
yes, 20%.
million. Yes.
Yeah, sorry, my math was off. I guess I'm a little tired after all.
And the best part of this is not only the amount of cells that you receive. You should care about the number. It's important, of course. But now that you know that
242.6 million cells is what I received over the last 2 days.
Correct. So
That's a tremendous amount.
but the most important part for me will be how many of them were actually alive.
Just like probiotics, guys. We know that just like probiotics. How many were actually alive?
You want to
Dr.
get
Dane?
all of their properties, and that's only possible if they're fully complete, if they're alive, right?
Yes.
And a good thing from our product is that patients feel so confident about it because they can see the bile before we get it into their drip. And you see how stem cells, when they're alive, they agglutinate, they get together. They form tiny little clots. That's why your drip had a special mesh, so they don't clot once they're about to go into your stream. But that's a proof that they're alive, right? So you want always to look after that on your cellular product.
Something. That cloudiness in the drip a bit.
Correct.
Okay.
And in your case, the viability was 99.9%.
So our babies were alive and rocking. 99.9% living.
Exactly. If you ever find a place that can match this viability, I'll give you therapy for free. I'll give everyone a therapy for free.
Oh no, we gotta watch that. Yeah, but that's a strong statement there. How can you tell that they're 99.9% free? Is there some kind of protocol or some kind of lab testing you do on my specific?
Of course, everything
cells?
is tested by cytometry test, which is described at the bottom of your report.
Okay.
And we are not only certified by the Mexican regulations, but also our lab is certified by American FDA for good tissue practice and good manufacturer practice. So we know that every single step, everything, little thing that we're doing or big thing that we're doing in our lab is done by the book.
Beautiful.
And so that for me is the most important part, the knowing how many of these cells were alive. And number two, or even as equal as important, will be the specificity of the product, knowing that you only receive pure mesenchymal stem cells suspended in saline water and nothing else.
Nothing else in there.
And that's described on top of your report over here. In order for us to call this product a pure mesenchymal stem cells, all of these cells must express on their surface all of these markers described over here. And in our case, you can also find the HLA-DR expressed on the surface of the cell. HLA-DR expressed as negative means that human leukocyte antigen is expressed as negative, meaning no immune system on this cellular product, meaning no way you could ever have an allergic reaction or rejection or graft versus host syndrome.
Or cytokine storm as well. All of it. So because of that, we know
There's
this
some
is
other
This
things.
is as safe as it gets.
Exactly.
But also just as effective.
Exactly.
Oh, beautiful.
That's correct.
Okay.
Now,
One thing about the viability of them. When do you guys test each dose? So I got the dose this morning. When you test and say, hey, these are 99.9% alive, you got 242 million cells over the last 2 days. When does that third-party testing happen?
just right before taking them out of the lab, once they were unfrozen and
So the last 48 hours?
No. The last 6 hours.
So you tested the viability 6 hours, showed 99.9% living, viable,
Correct.
with this kind of power, and then said, let's get them right now.
Right. That's correct. We just
So
get them
within
out of the
6
lab
hours
straight
of
to
doing
you.
it. I mean,
Yeah.
that's impressive. There's no way around that. That's impressive. We know that these are 99.9% alive 6 hours before they're administered into me.
Correct.
Amazing. Beautiful.
All right, so that's the three main things that you want to look after your stem cell product, right?
Okay.
Specificity. Number one,
Okay.
specificity, making sure that you're only receiving pure mesenchymal stem cells. Number two,
In saline, right?
in
So
saline,
the-
yeah.
In saline.
And number two, that you can find the HLA-DR expressed as negative.
HLA-DR expresses negative. Okay.
Number three,
No chance of adverse reaction with that.
correct.
Okay.
Number three, the viability of your product. How many of these cells were alive? And number three, the number four, the amount. The amount
The
of
amount.
cells.
So
Okay.
are they living? How many are you getting? The HLA-DR expression, and that there's nothing else in that
That's
being
right.
administered besides the MSC and the saline.
Correct. And that's why Mr. Tony included a couple of pictures that he took for you in the lab of your stem cells. Both of
Yeah.
them look quite similar. The only difference in between one and the other is the dye that he uses for looking at them through the microscope. But if we look carefully, sometimes we might be able to catch a dead cell which will look like bloated reddish dots.
Okay.
But in this case, it's impossible to find any because you got 99.9% of viability.
Wow.
Not even 1.1% of dead cells.
Yeah.
So
I mean,
That's
0.1,
why-
that's less than a million out of 242
exactly.
million.
That's why it's impossible to find any on these couple of
That's
pictures.
Wonderful.
Right? So this is for me the most important part for you to keep
Yeah.
from the report, right?
Yeah.
But still, we always like to emphasize the recommendations in order to get the best out of this therapy. So all of our patients will get this little booklet for them to go through, something to read and check back again and remember all of the recommendations that we've been telling them through the week, such as staying away from the non-steroidal anti-inflammatory medications for the following month,
Okay.
staying away from alcohol consumption,
No alcohol,
or
no
any other
NSAIDs,
toxins, drugs as well, of course.
marijuana, any other drug use.
You know, there's a lot of patients nowadays that are on some type of
CBD
Exactly.
or THC or something.
I only tell them, just don't do the vaping, just don't do the smoking. Go ahead and get your gummies with sugar-free gummies and
Yeah.
that type of thing.
Okay,
right?
so stay away from the smoke and try to administer
At
that
the
in
end, you
some
will be
way.
burning your alveoli, the tissues from your lungs, and you don't want to increase the inflammation,
Yeah,
right?
And what do you think, about a month, 2 to 4 weeks would be a good time to
Well, I will always recommend you to stay away from every toxin, right? But
Yeah.
but at least you don't want to interfere the process of homing for the following month after the therapy.
Okay, so 30 days would be best to try to stay away from the smoking, the drinking, or any kind of
Sunburns,
processed
dehydration.
food, sunburn, dehydration for the next month to optimize this.
Correct.
So remember, they will still work, but if we want these to, we're making this large investment, we
Correct.
want these to work for 1, 2, 3 years.
Get the best out of it.
Yeah, and really get the most impact. So longevity plus impact, this is best practice.
That's correct. So all of those recommendations will be described and written down in here. Anyways, as I was telling you the other day, or every single one of our patients will be part of our family for at least the following year, so they can always just leave the phone, give us a call straight to the office, and we will always answer any further questions that they could have.
Wonderful.
Now, these again are only the recommendations right here, and a short summary of what we did
Yes.
through the week, right? That you received 2 intravenous reinfusions, every one of them containing no less than 200 million, which from your report you can tell that the first one had 119 million and
Yep.
the other one 123 million.
So a little bit more today.
Correct.
Yep.
Correct.
Okay.
All right, and we always share with our patients the lab work as well.
So this is a CBC plus CNP. Complete
Oh, well,
blood count plus
CBC, Chem20, markers
Chem20.
of inflammation, rheumatoid panel, sexual
Rheumatoid
hormone
arthritis,
levels,
sexual
hemoglobin A1C. In your case, as you're male, prostate antigen. We ran vitamin D as well. And I may be forgetting about something else, but a thyroid panel as well.
Testosterone, free
Right.
testosterone.
Correct. So we always share all copies of all of the lab work with all of our patients, and we go through the explanation in case we find something. In your case, your lab work looks great.
Yeah, we found a few things. Let's go over a few markers here. We see
Right.
that my hemoglobin looks great. It's normal.
The leukocyte count is also in between range, which is highly important for us, as you
Yes.
were saying, because we want to rule out the presence of any active infections, either viral or bacterial.
Yeah.
Right? No signs of immunological incompetence that I could tell from your the rest of your platelet plasma.
Now, we did see slightly elevated eosinophils.
Correct.
And that could be caused by one thing, everyone, is I had done a parasite cleanse pretty aggressively a couple of months ago. So something like a parasite could cause high elevated eosinophils. What else could cause elevated?
Food allergies
Allergies.
can do that as well, or systemic allergies can do that as well.
And if you're eating something that you have a high IgG, IgA, so not just a true allergy, IgE, but an actual sensitivity, IgG, IgA, that could cause it to go high. So for me, almonds are on there. I have had a couple of almonds. Egg whites have been there very slightly in the past. I've been eating a lot of egg. So you could look at that way if you do see a slightly high eosinophil.
Now it was a bit elevated, nothing to be actually concerned about, but usually when you're in Mexico, this will be related to parasites. Okay. But it always needs to be related to each patient. You're coming from the States, it's a different thing.
Yeah.
But
best thing's probably to retest, because when I tested my CBC a month ago,
Correct.
completely normal eosinophils. So sometimes these can go, and the reference ranges can be a little different.
Correct.
Yeah.
But everything else came out normal. Now your glucose also slightly low.
Slightly low.
I don't know if you were fasting at the time.
Yesterday, I believe I had no sugars. I had, I think, some eggs.
Right.
In the morning, but my glucose was a little bit low. Maybe, yes, from a lack of eating.
But the rest of your values, your fatty lipids, your triglycerides, cholesterol, and your liver enzymes, all of them in between range.
Okay.
There's no issues with your bilirubins either. What else? We got the iron in between range.
Iron's normal, hemoglobin's normal, proteins, globulins good.
Rheumatoid factor expressed as negative.
Now, what does that tell us about rheumatoid factor?
Well, if it's positive and we get protein C reactive elevated as well as erythrocyte sedimentation rate, for example, might suggest that the patient has a immunological pattern involved affecting him, such as rheumatoid arthritis, for example.
Okay, so be signs of other autoimmune, maybe lupus or rheumatoid arthritis.
Correct.
Like
Most of the time it's related to rheumatoid arthritis. And a lot of autoimmune conditions, this could be a bit elevated or can have different values. Okay.
So CRP within reference range, normal, no signs of RA.
Yeah,
great to know.
Your CRP is normal, so knowing that at the time you're not having any flares, right?
Yeah, no times, And obviously,
hemoglobin A1C, that tells me how you've been behaving for the past 3 months, says that you've been doing great.
Now, one thing I would recommend, guys, that we can't do here is before you come, consider getting a calprotectin test, because we want to see an inflammatory marker of the stool, especially with IBD. And so I've been doing those for years, and I'll be going back and doing another one when I get back. But we're not going to be able to do a stool analysis.
Correct, and you can track all of the markers of inflammation whenever they come out positive. I mean, in your case, they are negative, but a lot of our patients have elevated protein C reactive. So in all of those cases, I will ask them to track that number out during the following month, 2 months, and 3 months after the therapy. And they will start noticing how the number starts decreasing, even getting down to normal, right? And it could stay like that for a long while, but it all depends from the environmental factors, how much we're taking care of our body to make the effect of the therapy last longer, right? Or as much as possible.
Okay, all right, so we have all of this page.
Thyroid hormone, all good.
All normal, so TSH normal.
T3, T4, the active
T3,
form.
T4, beautiful.
And sexual hormone levels, all of them in between range as well.
Good. You know, well, we got our second child coming on the way, so my wife will be pleased to hear that everything's okay. And one thing, guys, is I actually been checking my testosterone, and this is great because I checked my testosterone a month ago, and it seems slightly lower than it is today. So just for me, I was very happy to check it because testosterone can be a great protective agent for autoimmune.
Correct.
Great for energy, great for mindset, great for libido, great for fitness efforts. So mine came back with a reference range of 132 to 813, was about a 566. So that's on the upper end of reference range.
Yeah, make sure that you're eating your good fats so you can keep up with your good production of hormones.
Yep, and my favorite's always going to be salmon. I love cod liver oil, high in vitamin A and vitamin D, and avocados and things of that nature. So
I'm always up for a salmon, so.
Yeah, so my testosterone actually looks a bit greater because the last reference range I used was up to 1100. And this one's only up to 813 and came back quite nice. So blood work looked great, no major issues, and it's great to see. And I love that extra oomph because checking your blood work can be tough for us with getting our doctor to order it and going over it extensively and getting some extra stuff on your CBC like testosterone, like vitamin D, like CRP, which is not always ordered in a normal CBC.
Right, and in this case, it was pretty simple to go through it because you understand everything, right?
Yeah.
Doesn't matter if you are not related to the healthcare area. We will take the time to explain you everything.
And we pulled this blood yesterday.
Yes.
So we got the results within 24 hours. We didn't have a 7 to 10 day wait over. That's just extra cherry on the cake for me.
And we're only waiting for the vitamin D. That one will be received tomorrow, most likely, and mailed to you the day after.
Beautiful. Okay. And that was just on request. I mean, I said, hey, can you throw in the vitamin D in there? All right, this is wonderful. We have all this stuff. And now let's quickly talk about stem cells, exosomes, and natural killer cells, which are the three therapies you guys do here. And we talked a bit yesterday about exosomes and stem cells, but I want to put a button on that and really just conclude the big differences because as you guys are learning, I'm also learning from a doctor who's been doing this for many years and is constantly giving me aha moments that I want to repeat here. So we want to have a few of those repeats, and then I want to take most time to talk about the NK cells.
Okay.
That is one of the most exciting new therapies. That is different than stem cells, but can be used with stem cells. Like when I was talking with Raphael, he said, hey, it wouldn't be a bad idea to do stem cells and then maybe next year do the NK cells, considering my past with CMV virus and I believe parasites, you know.
And not only for viruses or bacterial infections or even dormant viruses, but it's great also for anti-aging purposes. And it's great for keeping us from having malformations or mutations in our body as well.
Okay, so that's exciting. Let's hold off on the NK cells and let's tie a bow on the stem cells and exosomes.
Okay.
Here. So stem cells. Yesterday we discussed that stem cells are just superior to exosomes when dealing with autoimmune disease. And for a number of reasons. And one of the reasons we said is because, look, stem cells make their own exosomes.
Depending on the needs.
Yeah, and so they are conscious single-cell organisms that can respond in the body and say, hey, I need to send a signal, I need to send some exocells to this part. So, and that also, because of that, they last much longer than exosomes.
Correct.
They also can work systemically, where exosomes will tend to work in one area.
Correct, and they will last longer because if they're alive, just like our product, you receive 99.9% of live cells. They will keep producing more cells. They will divide and produce new mesenchymal stem cells, right? That will keep sharing all of its properties in comparison to exosomes that will be immediately or almost immediately absorbed by the cells in it, and that was it. Right?
Beautiful.
You're gonna get a good result, of course, as well. You're gonna get some good signals as well out from those exosomes, but it won't be even close to the benefit that you could obtain out from stem cell therapy.
So in layman's terms, exosomes, we might be able to see results from it for a few months, but stem cells have the possibility of a few years.
Yeah, and also it's way cheaper to grow exosomes.
Yeah, so you might see out there, hey, I can get exosomes for a much smaller price, but you get what you pay for in this instance.
Correct. It's a great therapy, but in comparison to stem cells, it has nothing to do, right?
Yeah, and for us, who say, hey, I don't want to just feel better for a couple of months. I want to get rid of this IBD long term. I'm going to plan to keep my inflammation gone, which is the whole point of biologics.
Correct.
And so stem cells can give us more of that long-term success. They can work more systemically. They can consciously respond to inflammation as it comes to our body. And again, as we said, if you want to really push it, doing the functional medicine, working on your SHIELD program, continuing to live a life that reduces the inflammatory lifestyles is going to can help this be better.
Right.
So it's really superior in every way from what we see and for autoimmune
Stem cells
disease.
really do modulate inflammation, and
Yeah.
exosomes just help to try to modulate inflammation.
Yeah, it's a one-shot thing. It's a boom, hit it, and
Right.
kind of
Now,
loses its power.
they're all a boost to the immune system. Exosomes, mesenchymal stem cells, and natural killers. They're all good and a good boost to the immune system. They might just be, the effectiveness is different. That's why we must understand that every patient has different needs and tailor-made the therapy for every single one of them. In cases with IBD, with Crohn's, with ulcerative colitis, I think that the best therapy that could be offered, it will be stem cells every time.
Wonderful. So we see stem cells, that's where we want to go. Now let's look at the NK cells or natural killer cells. So what is a natural killer cell?
Those cells, as their name says it better, they are there for killing and disposing any bad stuff happening in our body. Actually, they're the first line of cells that respond to any inflammatory process or to any infection with either bacterial or viral infection, or even whenever we have dormant infections such as the CMV, for example, or herpes simplex, which is very common.
Herpes simplex, echovirus, Coxsackie, Epstein-Barr virus, cytomegalovirus, which was devastating in my case, which the doctors couldn't find. And or other things like varicella virus. I mean, any kind of virus. What about mold? People with chronic mold, NKs could be huge.
Yes.
What about Lyme disease?
All of them.
Systemic parasites.
All of them.
Any pathogens in the body. This enhances the immune system's natural killer cells to go attack, kill.
Correct. Well, with parasites, it's more complex because they are not a cell on their own. They're already a I don't know how to say it in
organism of some sort.
They're an organism, exactly.
Yeah.
I was just wanted to find a better word. So with those, it's not like the natural killers will easily just attack them. It will work on a different way, but it will also be beneficial against the parasites and the bad effects that we get out from having an overgrowth of parasites into our bowel. But directly talking about the bacteria and the viruses, they will attack them straight and also dispose of any malformations happening in our body. The more we age, just like with stem cells, we're in need of natural killers. Our own production diminishes substantially from 25 years or onwards. So we all get benefit out of a good natural killer therapy. Also for the anti-aging purposes, not only modulating the autoimmune system, but for anti-aging purposes. Okay, because it gets rid of the bacteria, the viruses, the malformations we were talking about, but also the senescent cells.
The senescent cells is big. So before we jump into the senescent cells, this is going to help kill those infections, and it does also have immune modulating properties, like stem cells.
Not as stem cells, but they also modulate inflammation.
So would you say the stem cells are much better and effective?
For modulating inflammation, 100% will be stem cells.
Calming down the inflammation long term, stem cells are going to be more effective for us.
Correct.
NK cells more of an attacking with some immunomodulation.
Correct.
Okay, wonderful. So now when we go after these malformations, as you were discussing, of senescent cells, what is a senescent cell?
Well, once I heard an explanation that I liked on the internet about a lady referring to them as zombie cells.
Zombie cells.
That just sounds very accurate to me.
Yeah.
Because those cells are part of our own system. Our body does not identify them as harmful cells. So they are kept within our body. We do not dispose them, but they are just interfering, sending bad signals and misinformation with the surrounding cells, because we all have these cells But the more we age, they will lose all of their good properties, and they will just start acting just like zombies. They will be alive, but just interfering, sending bad signals. And this leads into cellular malformations or mutations.
So these could turn into tumors.
and-
These could cause more cancer.
Or oxidative stress that in
Yeah,
consequence
oxidative
could
stress.
lead to developing cancer tumors or whatever, right?
So senescent cells are a big part of what we want to reduce in our body to reduce cancer or other
well,
formations.
senescent cells are the main theory backing up the process of aging. Right. So if
okay.
we stop the progress of our production of senescent cells, we are slowing down the process of aging.
So one of the most amazing features of NK cells is they have the very rare ability to kill senescent cells.
Identify and kill them, and that's the only thing that could get rid of senescent
So
cells.
fasting, long-term fasting, can it kill senescent cells?
No.
Yeah,
No.
that's
You
what-
cannot get rid of them.
Well, yeah. Me and Rafael Gonzalez, the lead scientist here at Rehealth, we were talking about this, and he was talking about how even long-term fasting can be great for calming down the amount of senescent cells your body's making, but it can't actually kill them.
Exactly.
NK cells is one of the very rare things we know can safely kill senescent cells in the
Exactly.
body, and therefore potentially increase longevity.
So far, it's the only therapy, natural therapy that we can do to get rid of them.
Yeah.
That's it.
So it's one of the very few therapies, and our body as it ages has less NK cells to kill all these senescent cells.
Right.
So this could also not only play a role in reducing cancer cells or cancer formation, tumors and such,
Correct.
but it also can increase our ability to live longer.
Right, and if
It's one of the best longevity.
Correct,
type.
100%. And if a patient, for example, had a history of having cancer no long ago, it could be a magnificent therapy. Try to stay on remission, right?
So this is why I want to bring this up today, guys, and is because many of our members have said, "Hey, Dane, I've got medium high-grade dysplasia." And now dysplasia is abnormal cell growth, usually in the colon somewhere. When they're testing cells or seeing abnormal cell growth, that could turn into cancer.
Right.
So it's not cancer yet, but it's very high risk of cancer. You can't do stem cell therapy if you have high-grade dysplasia or a past diagnosis of cancer.
Or even if it runs in the family, it could be a great idea to try it.
If it runs in the family. So quickly, so NK cells could be a better therapy to consider if that's the position you're in. But let's talk about a dysplasia diagnosis or a cancer in the family and doing stem cells. So from what we've discussed, if I'm trying to repeat it back, and correct me if I'm wrong, but the stem cells increase the growth factors in the body that feed all cells, potentially cancer cells as well. Is that right? So we don't have evidence that stem cells could empower cancer cells or tumors to grow, but
That's
there's
correct.
no evidence to suggest it doesn't yet.
What we know is that 100% sure our cellular product is mature enough not to turn into any bad stuff.
Yeah.
But as you're saying, even if there's a tumor or cancer going on with the body, but just like you're saying, there's no proof that these nutrition factors being released by the stem cells could not be absorbed or used as food by these tumors or cancers, right? So we rather play safe or extra safe, and that's why all of our patients must be on remission for at least 5 years to get stem cells if they had a past medical history of cancer.
And that's a lot of times it's safe, there's not enough evidence. Maybe the future will change that, but for right now that's the best practice.
But also because in the meantime there's better things to do than stem cells. If you were just recently diagnosed or just recently on remission, natural killers should be the way to go for you.
So for those people who are dealing with that kind of situation, this is where NK cells can really come in. They can kill the senescent cells. They can help fight off cancer. So what are the role? Can it actually go in there and help, in your opinion, reduce the size of a tumor or the amount of cancer we're finding or the stage of cancer?
I will use them
that?
more as a prophylaxis. And there are certain cancers that do not evolve that fast, such as prostate cancer, for example. Those type of cancers, we got magnificent response out of the NKs, right? And that's the point, trying to reduce the progress or keeping the patient away from having a metastasis or the cancer spread somewhere else, right? But if the patient already has a tumor, a big tumor going on, or he's stage 3 or stage 4 in cancer, there's better things to do. Other cell therapies, such as dendritic cells, that we can also talk about.
Yeah.
But that's not the main 3 therapies that we offer here.
Yeah, so that could be something in the future for us to
Dendritic
discuss.
cells. And we
Dendritic
have had
cells.
very good response treating cancer patients with that one.
Okay.
It's basically creating. I'm just trying to put it in simple words, right?
Yeah.
So everybody can understand. It's a bit more complex than that, but it's basically creating a vaccine out from the information or messenger RNA obtained from the tumor that the patient had. The first tumor that was identified that hasn't been radiated, we obtained the information out of that tumor. We put it with dendritic cells, so they will be now aware about that specific tumor or that specific bad growth happening in the body, and the immune system of the patient can react against it, can do something about it. See, when we have a cancer, our body usually does not identify it immediately. It takes time, and sometimes until it's all spread over the body, right? So this is trying to give the patient a chance to fight it back, maybe take it one step back, and try other therapies again.
So if a person was in stage 3, stage 4 cancer, colon cancer, for instance, they might want to start looking into something like dendritic cells. Natural killer cells are effective, but there could be more effective therapies for advanced cancer. If we're dealing with dysplasia or something like that, NK cells will probably be the best place to start at this clinic. And so we can reduce cancer cells, we can kill off senescent cells, we can fight underlying infections. By the way, these infections could be linked to the cancer itself, meaning chronic inflammation from active viruses not treated, from active mold and Lyme disease not treated, can cause more risk of cancer.
At the end, all of them are changing the way we express our genes, the epigenetics, and that's how all of the bad stuff happens.
Yeah, so one thing for me, guys, and I'm going to tell you what I'm thinking for next year is I'm very interested in coming back and doing another breakdown on NK cells in 2024. I've had a large amount of cytomegalovirus in my body, but my latest tests with Dr. Armin have showed 0 active CMV in my body using our natural therapies in the SHIELD program, but I am getting these things tested. So that's another thing you can do right now is start getting tested. Come to Dr. E, come to the clinic with more research. Do I have mold? Do I have Lyme? Do I have underlying fungal growth, mold? Do I have active viruses? These are all benefits in the SHIELD program you can use so that when you come here, you can get the biggest bang for your buck and the best results with a more detailed plan of what you should do and why. So when I was talking with them, I told them about my background and said, okay, for you, we think stem cells are going to be the best to start. Then maybe consider NK cells with your background and past with viral load, because the viral load, in my opinion, was the thing that got me hospitalized and nearly took my life in 2014. So that's wonderful to see these differences. Let's finish off today's training talking about the different places we can get stem cells.
Okay.
So we've got 3 places we can get them. We can get them from bone marrow.
Well, the 3 main ones, because we can obtain them from tooth, for example. But the 3 main ones.
3 main ones that are studied, that are used at clinics, that if we are going to go say, I need a clinic, I want to invest in this, these are the 3 things any clinic might be talking about, right?
Correct.
So we've got bone marrow derived.
Bone marrow.
We've got adipose tissue, which is from the fat.
Correct.
And then we've got the most popular, the umbilical cord.
Correct.
But there are 3 different types of getting the mesenchymal stem cells in the umbilical cord. That's the umbilical blood.
Umbilical cord blood, yes.
The umbilical cord blood, the Roirdan jelly, and the umbilical lining.
Correct.
Okay, and we here are doing the umbilical lining.
Umbilical cord lining.
Let's first start with the bone marrow. And tell us about the bone marrow. How does that stack up against the other therapies?
Okay, number 1, because it's more invasive. To get them, I will need to do a bone marrow aspiration from
That's the big needle in the back where everyone's screaming and...
Exactly.
Okay.
Of course, if that would be the case, we won't do it the way it's done in the US without sedation.
Yes.
That's crazy. I don't know how you guys tolerate going through that process.
I have not done this. I don't know.
But, so number 1, obtaining them from umbilical cord is way less invasive, right?
Okay.
Number 2, you don't want to receive your own cells that have your age, right? You want to get brand new cells with all of their properties.
So old cells. We want new cells.
Yeah, exactly. So the faculty of differentiation from these cells might be more limited.
Okay.
Okay, so those will be the three main differences why we do not offer cells from bone marrow to our adult patients or autoimmune patients, right?
Maybe children.
Maybe children, yes. In
Yeah.
some cases we do that. In cases of kids under the spectrum, for example,
Yeah.
in some of them we might use cells from donor. In some others we might use cells from bone marrow. It all depends from every patient.
So if someone has a child and you do have, and you know, there is the ability to say, hey, we could do a bone marrow derived, and you could discuss that
Yeah.
and build them a custom plan when they get on their consultation.
Right. Now, if the kid is older than 13 years old, somewhere in between 13 to 15 years old, we will offer as first line the cells from donor already, okay?
Beautiful.
Because we want to obtain all of their properties, right? And by that time, the kids are already losing some of the properties the more we start aging.
Do we usually find that bone marrow derived stem cells, mesenchymal stem cells, are more cost effective than the other therapies?
No.
It's the same pricing.
Yeah.
Okay, so it has less benefits, but we're looking at same pricing. Okay, and then what about the adipose tissue derived from the fat?
Well, that one, it's very good source because you can probably obtain the most concentration of cells coming from that source. But statistically, it says that most patients will have a good response with those.
So more.
But I'm not good with most patients, right? I want to know that we all good, right? That all the patients.
So higher risk.
Higher risk, yeah.
Higher risk of a reaction.
Well, and also the processing is different because it has you know the adipose tissue on it that we need to get rid of it. Imagine if you're doing it through an intrathecal reinfusion and reinfuse a bit of fat tissue directly into the CSF, or creating a clot by reinfusing them to your IV, right? So that's one of the things that we don't like, the processing of it.
Yeah.
And also
there's more areas, multiple areas of risk.
yes, and also it's way more uncomfortable as well for the patients. We must do it from a tiny liposuction, which at the end is not for aesthetic purposes, so you ain't living with a flat abdomen, the clinic anyways.
Yeah.
You're just getting the discomfort from multiple poking in the area in order to obtain enough fatty tissue and then doing the processing. So at the end, we know that the most convenient source will be not to bother the patient and obtaining the cells from the youngest source as possible, which is from umbilical cord.
And again, a client or patient is looking around a similar price for this as well.
Yes, the price will be always in the same frame.
No matter if we're doing umbilical, adipose, or bone marrow. Okay, so now we get to umbilical cord. So benefits here: no discomfort, new cells, and the lowest risk.
And if you're coming with us, you know that the cellular product was never exposed into COVID, was not harvested during COVID times. Mother, dad were never exposed into that virus ever, or the vaccines, okay?
Yeah.
As by doing them with our protocol, obtaining the cells from the umbilical cord lining, we are able to expand those cells and grow them to offer up to 3,000 therapies per umbilical cord.
Which is the advantage of this specific clinic, because
It
that's
has
your
been
patent.
tested.
Because now we're talking about the generic value of what about umbilical blood, the jelly, how do I pronounce it again?
Wharton's jelly.
Wharton's jelly, my memory's losing here. Wharton's jelly, the umbilical blood, or the umbilical cord lining. And so we are choosing to do the umbilical lining.
Right.
Which is the safest of all the umbilical cord, to have the lowest chance of any of that risk we talked about. Even if it's minimal, this is, as you keep saying, impossible for that reaction because of that HLA-DR, which the umbilical blood could have positive, or the Wharton's jelly could have positive.
And also you need to look for a match if you're using cells coming from umbilical cord. If not, oh yes, we have heard. You just gotta Google down clinics that had.
So no match needed.
No match needed with her product because it is HLA negative.
So the lining is going to be HLA negative. It's going to be the safest with the same impact as the blood. We don't have to worry about
We can use it more often, so we don't have to worry about the chance of the donor having
Correct.
all sorts of issues.
Correct.
We can get more use out of those linings, and then when you top it off with your patented clinic, you have your own warehouse. You're not outsourcing. Most people are outsourcing their warehouse. You know,
That's why we managed to give you that viability, offer that viability
Yeah.
of 99.9%.
it's all in house, so we get all those bonuses, the 99%. And we know that we can get, and because of that system, we can have one cord that we've tested properly and get thousands of treatments because we're able to use that and then grow them properly in our own laboratory.
Which also make it more safe at the end because it has been tested several times, right?
And you're only using 4 or 5 different donors.
Exactly.
Not 400 donors.
Exactly.
So the risk of, oh, this was a bad donor is
And testing them every time and
minimal.
Yeah, against mutations, family history, genetic deficiencies, viruses, bacteria, everything, you know?
Beautiful. So we're seeing that to get the best that science is telling us is the umbilical cord lining. Now, it's more costly for a clinic to say, I'm going to be picky. I'm only going to use the umbilical cord lining over the blood and the Warden's jelly.
Yeah.
So this is going to
We need
cost
to
more.
invest much more with the materials that we're using for doing the growing and the expansion of the cells. As everyone will give us up to 3,000 therapies, we need to make that magic happen.
I think this is an important topic because one of the questions I really had when I was looking around at many clinics, and you know, when I really chose this, I mean, part of it, shout out to Dr. Josh X and Dr. Dan Pompa, who both work with you as well.
Yeah.
And when I was speaking with Dr. X, he said, Dane, I got the clinic, I got the guy, and he just sent me right over to Raphael and you guys, and he said, please take care of Dane. You guys are the best at this. And I'm telling you, I'm very happy with everything I've heard and how I've experienced with it. But besides those mentors referencing me here, it's you continue to see every single point done properly, which is what we can talk about now. And it, you know, because I was looking at other clinics, you're seeing other clinics out there that might be cheaper. They might be saying, hey, we're going to give you HBOT, we're going to give you ozone, we're going to give you 2 exosomes plus
or vitamin C
drip, and
glutathione,
and then we're going to give you 100 million stem cells.
Yeah.
So, you know,
and
so
they will not prove the viability, the specificity, nothing. Right?
Where did they derive them from? So these are great questions when you're looking at a different clinic, because you should do your homework. You know, we're talking here, but go and check. Do they get them from bone marrow? Do they do them from fat? Do they do it from umbilical cord?
Have they ever had any bad reactions into any of their patients?
And here, 12 years, no major.
12 years, zero cases.
0 cases. That's huge. And are they getting it from the lining, the blood, the Warden's jelly? How many are they giving you? What's the viability?
And you know what? A big thing.
And
make sure that when you're doing your research in between clinics, you get to speak with the doctor. You'll be amazed about how many crazy stories we get to hear through the phone that have been told to those patients.
Pay without a consultation. Well, I actually had something similar. I went to I went to one clinic that was, and I just reached out to them, and very famous clinic. And I asked if I could speak with someone, and they said you got to fill out the intake form. Then they sent me a large 5-figure bill before I'd even spoken with somebody. I didn't really feel it was taken care of. And when I reached out to you, I had a fantastic conversation with Raphael. I had a fantastic conversation with Dr. Alberto as well, and he took the time to send me the clinical research to go over these things. And I really felt taken care of and was trained, because this is such a large investment and something quite scary for a lot of us, saying, what are these stem cells? What's the dangers? I mean, all of this, we need to feel safe and taken care of. And I really believe you've taken the time to train me. And that's why we're taking this time with everyone here, that you can get a lot of your questions answered on yesterday's and today's training. But, I mean, we're seeing over and over again, why are we spending more money on something like umbilical cord lining and the safety and everything being in-house and reducing the amount of donors you even need and proving viability and third-party testing these things? I don't see a stone unturned.
Right, there's none.
And it's very nice to come to Cancun. So as I've been here, It's sunny. It's a beautiful hotel. I've been staying at the Westin, which is a very nice and lovely place to stay with good food and lots of gluten-free options.
And we got our patient experience coordination team, a couple of ladies that will be helping you.
Pick me up from the airport, pick me up from my hotel, drop me back off at the hotel, take me to the airport.
They will make your trip as smooth as it can be.
Yes, and that's been very, very nice. And you know, and I was looking at, you know, I had a friend come in town to visit me, and he was going, and they were, you know, charging money for the taxis and charge of this and charge. It's very nice to have that taken care of, and I think it's a big part. So, you know, when I'm looking at this, I'm going to set, you know, you guys should be able to see these breakdowns as we go over them, but we're seeing in every way it just it's more expensive in certain ways to do what we're doing, but if we're going to take the time to invest in long-term healing, the most impact, the safest, the easiest, the least amount of discomfort, umbilical cord lining, done with a place that has in-house warehouse, that's going to prove viability, that's going to give you enough stem cells to get the results. And the research is saying that we need 200 million stem cells or more for optimal results. And today I received over the last 2 days, 242 million. One of the questions I had is, well, you know, and when I came in, I was a little worried of what if I get a little bit adverse reaction from getting too much at once, because other clinics were saying we're going to give you 50 or 60 million over 3 days. And then I said, well, can I get them over 3 days? And you guys said, sure, you can get them over 3 days, but we don't really have a problem with our specific stem cells giving you 100 million over 2 days. So if you want to take 3 days, you can take 3 days. So I actually considered maybe I'll take it over 3 days because that's a lot. And I was hearing other clinics tell me 120 million, 110, but I got 100 million plus on both days, and I feel fine. And I literally got that dosage 5 minutes before we started today's training.
Yeah.
So it's not like I had to go lay down, put an ice pack on my head, take a nap, let's do the training tomorrow. No experiences like that.
No.
Any last words you'd like to say to people who are considering stem cells?
Well, that we're here for you guys. Feel free to reach out to us anytime through our website, and we will be happy to cover any medical questions. And every time it will be either Dr. Alberto, Dr. Rafael, or myself attending your calls every single time. So at least you know that the information that you're getting comes from an actual physician.
Beautiful. And we will put links below where you can fill out the intake form and just let them know that you came from Crohn's Colitis Lifestyle, and we should be taken care of.
Get better.